ask a quick question before we go back to Josh. I'm sorry to interrupt everybody, but we've had some questions about how to best access Beacon, and that can be to help understand, who's a good surgeon, what's a good cancer center, sort of that thing we were just talking about. And I wanted to ask Morgan, who's here from Beacon, who can help us understand, because there is a concern by folks on the webinar, by folks in general. How do you find Beacon, and what if you live somewhere where you're far away from all of these big centers? What do you say to that, Morgan?
Absolutely, and that's a really great question. The best way to access Beacon is via our website. We're open 24 hours a day online. Our participants have probably found us some way, shape, or form. And the best way that folks can find us is sometimes through their urologist. We have a lot of folks that come to us who say, my urologist recommended that I look up Beacon. And there's a lot of other folks around the country that are doing a good job at spreading the word. Some folks get their urologist their information about Beacon and say, hey, I found them on my own Dr. Google search, and they take the information back to their urologist. We also have some great partners in industry who try and spread our information to the urologists they talk to as well. Overall, the best way to find us is online. And then as far as finding reputable doctors with Beacon, we do have a really great scientific advisory board. We don't typically recommend one doctor over another doctor, but there's great teams around the country, and we do try and point people in the right direction if they're just floundering, and say, well, we know that there are great doctors everywhere. You can probably find a doctor close to you, but if you need some help, here are 3 or 4 different places that are within driving distance of you.
Great. And the one other thing I would say, the one good thing that's come out of COVID is that we're actually all doing a lot of telehealth right now. So if you need a referral or if you want to even just call a cancer center that Beacon recommends and say, can I see Dr. Meeks by telehealth? Not Dr. Meeks, any doctor, you should probably be able to do a one-time consultation or even some follow-ups, clearly not surgery through the phone or through the web. But that's one thing that has come out of COVID, that we are able to see people remotely even when you can't drive sometimes. Back to you, Dr. Meeks.
No, I think that's really wonderful. Again, I think those are great points that, even if you just want to talk about where things are and what, kind of care you've received, I think most centers are open for that at this point. It's the 4th most common cancer, but at the same time, there's a lot of heterogeneity in how it's managed. So I think, having a visit with a bigger cancer center or someone who specializes in it, it probably makes a lot of sense.
I had never even heard of Beacon, to tell you the truth, when I first started. I didn't know about Beacon until Dr. Morgan told me about it 3 years later when I was going for the chemo.
And I think Beacon was young. When you started, Beacon was young. And Beacon's popularity and really just their ability to touch people has really expanded just time and time and time again now. So they're so much more accessible. There's so much here. And I'm glad you made it to them. Anne and Darrell, we have had a lot of questions. Just want to ask your opinions. How do you know if the doctor is the right doctor for you? Are there questions that you can ask? And the things that I would ask are things like, even just seeing if the doctor allows me to ask a question, because sometimes doctors don't feel comfortable letting people ask questions, and that may be time pressures or personality or whatever it is. But I need to be able to ask questions of my doctor, so that would make me feel comfortable. But how do you know? How do you choose that person that's right for you? Darrell, what do you think?
A lot of it's checking credentials. So even on the Northwestern site, being able to check the background of the doctor, publications. Both of you are, great published professionals, and even Dr. Meeks having his history in robotics is it's awesome. So that's a way of building trust. Also, Anne mentioned how at ease she felt with Dr. Meeks immediately. That's key. And, communication, I think, is critical to having that patient doctor relationship and trust. and say, feel free to ask questions anytime. I'll get back to you as soon as I can. That's where, you feel that the doctor cares about me, and that, I'm not just a patient.
Absolutely. So credentials, making sure that they have the training that they need. If they're going to be doing a surgery on you, they should be a urologic oncologist, so they have that training. That's really important. Are they engaged in academics? That's important for some people. Other people, they just want to know, hey, how many surgeries have you done? Do you do this every week, or do you do this once every 6 months? Because you really, I think, need to choose a doctor who does these surgeries on a regular basis. And like we said, that personal engagement, that connection that you have with that doctor. And Anne, what are your thoughts?
I think you just have to trust the doctor from the beginning. And I started off with Dr. Lewicki. She was recommended to me. She recommended Dr. Meeks to me, who recommended you, Dr. Morgan to me. And I just, from the time I met each of these doctors, I have to say there was something there, and I don't know what it is, and I haven't felt that way with every other doctor, years ago, just, for other things. But there was just something there that made me feel that Dr. Meeks knows what he's talking about. Dr. Meeks understands what I'm going to go through. He's telling me the truth, because the questions that my husband and I asked him, he was able to answer them, and he answered them on a down-to-earth basis, because, medicine is not my, thing, all these big medical words. And he brought it down to earth. He made us understand, like, what are our choices, this is what's going to happen. And we put our trust in him, and my husband felt the same way. And I think if he had felt, oh, wait a second, we need a second opinion, I probably would have gone for a second opinion. But the both of us had a feeling right from the beginning about Dr. Meeks and about you, Dr. Morgan, that, yep, you guys are looking out for my benefit, and you know what you're talking about. And yeah, did I look later on when I got home to see, what your credentials were, what you've done before? I did. I went on those sites, and I, would do that for any doctor. And I was very happy. I could not see any reason to go get another opinion at that point. I just felt like, yep, I'm making the right choice.
Can I just ask one quick question about support services, not the support in your family, but about things like physical therapy, nutrition, lifestyle. These are all things that Beacon addresses on their website as well, but are part of the sort of softer side of caring for cancer. Or, I don't necessarily think they're softer. I think they're critical in keeping you whole as a person. So wondering, what things did you find important as you're recovering from surgery, recovering from chemotherapy, trying to keep your life on track? Darrell, what do you think?
So the Beacon blog site, Insight, was part of, or Inspire, was really part of my support network and a way to get more information. And it's all patient to patient. So I think that really helps understand when someone's been there with the same condition.
Great.
I think that's important. Yeah, but I didn't have that. I really can't answer that. To me, it was what I read.
You told the physical therapist to take a hike. We heard that, Anne.
Yeah, I did. Exercise is not my thing.
Goodness. Well, you know what? I do want to give Mary Kate an opportunity to talk about support groups, which are also a big part for some people of the way that they cope and the way that they move forward. Mary Kate.
Thank you, Dr. Morgans. Yeah, so we're excited to use this kind of as our kickoff to start virtual support groups here at Northwestern. So as Dr. Morgans mentioned, one of the good things with COVID is that we can do everything virtually. So the group is open to anyone. You do not need to be a Northwestern patient to attend. So anyone on this webinar, we would love for you to attend. Information can be found on the Beacon website under support. You'll need to RSVP. We will then send you a link of how to access the groups. We're having a group for patients, caregivers, survivors, just a general group, which will meet the third Wednesday of the month at 6 p.m. Central Standard Time, and then one for females, which will meet the first Thursday of the month at noon. So the groups will be led by our amazing patient advocates here. So yeah, if you have any questions, just email Morgan, who set up this group, or look on the website and we can send you the information. hope to see you there.
Great, thanks, Mary Kate. Dr. Meeks, any other thoughts or questions that you wanted to ask?
No, I mean, I really wanted to thank our panelists for being here today and for Beacon for setting this up. I mean, again, there's a lot of ground that we try and cover for folks in the best way that we can to give them the best advice we can to make the decisions that make sense for them. So I think it's invaluable to have a resource where folks can talk to someone and just be empowered by the strength that they have and, you know, the wisdom of what they've been through. So thank you both so much.
You're welcome.
Thank you. Looks like Morgan is back. Morgan, did you have some words for the team?
Yes, we just wanted to thank you so much for being such valuable panelists today. And I think there was one question that I saw that I think I can generalize because I saw it pop up a couple of times for Darrell and Ann. As patients, when you were first diagnosed, would you say that it was easier to take it just one step at a time and kind of wrap your head around that one step? Or did you think that there was more that you could be doing?
I just took it step by step, you know, as it was recommended to me, what I should be doing, what my choices were. I didn't want to wait any longer. I just wanted the cancer gone. That was my main thing. And it's like the sooner the better. And I just, you know, kept asking, when can the surgery be done? When? So I don't know if I would have taken more time. Dr. Meeks said, don't worry about it. You know, it's not going to get worse in the next few weeks, months, but I didn't want to do that. That was my choice. You know, just do it as you know, as I know what to do, and just do it and get on with my life. I guess that was my main thing.
What about you, Darrell?
I'm a certified geek, so I kind of need to know a lot of information, but I do try to take everything step by step. And it's hard when you've got a busy life to fit it all in. So, you know, kind of understanding what is the timeline overall is key.
Absolutely. And thanks so much for your insight. And then Dr. Meeks and Dr. Morgan, let's take this to a non-muscle invasive. If you have patients that are non-muscle invasive, are there things that you suggest to them in that same vein, whether just trust the process, take it step by step, what else they could be doing, that sort of thing?
You know, just, you know, for non-muscle invasive, I think, you know, the hard thing is for the patients diagnosed, you know, understanding the spectrum of bladder cancer as far as where they fit in that risk spectrum. I think that's the first thing. You know, the patient diagnosed with a low risk tumor thinks that they're in the same boat as someone with a muscle invasive cancer. And really, these are biologically very different. We treat them very differently. It's our responsibility to try to explain that to them in the best way that we can as far as recurrence, progression. I think having someone that's willing to kind of sit there and have that discussion with you as far as, you know, this is what's next. This is what I see the next 2 to 3 years looking like for you. Our major obstacle is your cancer coming back, but not necessarily getting worse. These are the therapies that we're looking at. I think that's, you know, it's really hard because when you're diagnosed, everyone thinks about bladder removal as being the next step, almost no matter what grade and stage you are. So again, I think trying to get clarity and get a good discussion about where people fit on that spectrum. Because again, 80% of folks are going to be non-muscle invasive and will probably be able to preserve their bladder. And then the 20% who are in the more muscle invasive and advanced state, you know, that's almost a different treatment group entirely, and it's a different momentum and a different timing. And so having that together, I mean, the good news I'd say for the non-muscle invasive folks is that, you know, we have so many more options. You know, we have systemic therapies now we can offer patients. We had, you know, less than one therapy when people don't respond to BCG, they get bladder removal. Now we have so many more options for them. So I think, you know, that's quickly becoming a team approach, again, with how we're treating folks. So I think that the future is only going to be brighter for patients.
I would agree. And I would say, as you go through the process, I'm never the kind of person who will just trust in whatever process. Like I said, I need to be able to ask questions. So if you can trust, and that's your personality, then trust your doctor and go with that. If you can't, it's okay to ask questions, and you should. And when you have non-muscle invasive disease, just like with any other health condition, you're going to go through your treatments, but you do need to try to have a diet that's a nutritious diet, a heart healthy diet, low in saturated fats, high in vegetables, high in healthy grains and fruits. Get some physical activity. You don't need to run a marathon, but try to be as active as you can be, pandemic or not. We all have to try to do that, because the healthier your body can be, regardless of what you're dealing with in terms of BCG or other installations and other treatments, the healthier that you're going to be, both physically and mentally. And that's the other piece. Make sure you pay attention to your mental health. Make sure you talk to people when you need to. If you feel like you need extra help, you can always ask your team, can I speak with somebody? Is there a social worker? What other supports can I have? And never be embarrassed to ask questions or to ask for extra support, because you deserve it.
Great, thank you so much. And unfortunately, we are out of time for today. I want to thank the panel again so very much for your time, your expertise, and generally providing this resource for others who are in the same situation. I do want to take a moment to thank our sponsors again. We couldn't do this without the support of them, and our sponsors for the Patient Insight webinar series are Bristol Myers Squibb, EMD Serono Pfizer Partnership, Fairgene, Genentech, Merck, Urigen, and that's all. Again, thank you so much. And I am going to end the program now.
Thank you.
Thank you.
Thank you.